did stop for a while in order to deal with the fact that we were going through COVID. So the enrollment mandates were put on hold, but we're back here. We are anticipating that in January, they're going to be looking at everyone's enrollment and will be acknowledging and notifying any grantee who's under enrolled. Our goal is to be fully enrolled. Our goal is to not be back on that enrollment plan that we were on before. And in order for us to do that, we're going to have to work collaboratively together with all of you to make sure that we're able to meet our enrollment numbers across the city. I just want to make sure that everybody understands what that means. If we're not fully enrolled on either one of the grants, then we are going to be monitored. There's additional work that your teams will have to do, additional information regarding wait lists, enrollment, and all of that, that we will be gearing up to do. Hoping that we don't get there. I'm working on full enrollment, wanting you to work on full enrollment, and then we work together to make sure that we're able to meet it. We will be looking at numbers consistently and talking to all of you whose numbers are not moving in the direction of full enrollment to try to figure out what's going on your end, how we might be able to assist, or if there are adjustments that we need to make. And so we'll be working this through over the next couple of months as we're talking about enrollment. Right now, as I said earlier, I'm looking at enrollment every day. The numbers are really, really low. And so we do need to have you work with your staff and make sure that they're going in and enrolling your families. The next one, again, and I kind of mentioned it, the closeout of Head Start, Early Head Start is a huge lift. Being a super grantee, it's a lot of work on our part. And again, I thank those of you who've been participating in some of the different actions that we're having to do. But again, our responsibility is to make a disposition about all of the inventory, for example, and equipment that has been purchased on the Head Start grant, some of which I'm sure we'll say we're just going to dispose of those items because of the quality of the item. Those of you who are grantees, what we're going to be doing is working with the region to determine how do we then affect the disposition of equipment that you purchased on our Head Start grant, and then acknowledging it on your Head Start grant. More work to be done on that, working with the region right now to determine what our path forward will be for all of that. But again, we've got some work to do and making a disposition on all of those various items. And we've got tens of thousands of items that have been acknowledged. And I know the staff have been out and actually putting their eyes on pieces of equipment in your sites as required. And so I thank you for that. We'll be working with the region to finalize all of this. And for those of you who are grantees, we'll be finalizing that with you so that you know what disposition is being made about the equipment that's in your house and in your sites. And so more information to come on that. I do want to acknowledge that COVID cases nationally are rising in children, and we're seeing a little bit of an uptick here in Chicago. And so again, I just want to remind everyone, we're still in COVID and the necessity, and I know the mayor has said, we have to wear mask mandates back in offices, in stores, and in places. Again, we're moving away from the relaxed mask mandate back to the mask mandate. We've never removed it in child care centers. We've always said children and staff needed to be masked in their programs. We want to make sure everyone is following that protocol. I know you're doing all of your mitigations. You're doing everything from the cleanings, the hands cleanings, the hand washing, taking temperatures. You're doing all of what you're doing on your side. I'm just asking that you continue to do so. We will be monitoring to see what's going on with the uptick here in our programs as far as looking at the rising cases and what does that mean and what community area are we seeing any of these that are going up, so that we are in partnership and in communication with IDPH and CDPH around what's going on. Again, one of the things we know is that one of the things we'll be looking at is trying to figure out how do we approach the next iteration of COVID vaccines. We anticipate Pfizer, who is will be asking for emergency use authorization for a vaccine for younger children. And so we'll want to know that, as soon as that happens, that everyone is aware that this is going on, this is available, because again, we've got staff in some cases, not all, because there's some vaccine hesitancy out there, but we've got staff that's been vaccinated. We have families that are vaccinated. We have community residents that are vaccinated. And the next iteration of vaccines will be for younger children. And so we'll want to make sure that we're talking about it as we come closer to that. And we're finding out ways to make sure that our families are able to access vaccines for their children. And so we'll be looking for ways to partner in community to make sure that we're able to implement it as soon as those vaccines are ready. But again, I'm just asking everyone to stay vigilant. The Delta variant is no joke. People who have been vaccinated are coming down with COVID, and it is the Delta variant. So I'm just asking everyone to stay safe, continue to do what we know are the mitigation practices in our arena that has worked, that we continue to do that, keeping ourselves safe, doing everything we can for our children and families personally, and the children and families that we serve. A lot of work ahead of us. I'm just asking us to stay the course. We're here in August. We know that we have a few more months before we get over the hump as far as getting to a vaccine for younger children. So do everything that you can to monitor and keep the children safe in your environment. Again, I thank everyone for everything that you do every day for all of our children, families, your staff, and for yourselves. And we're here to support, and we'll continue to do so as we go through this. I'm not going to spend all the time. I'm going to go back in and start looking at some of the questions that have come up in the chat box, and we'll respond to some of those. But right now, I'm going to let one of my staff members go on from Program Operation Updates. I'm going to go ahead and let Seth talk a little bit about 45-day requirements. So thanks, everyone.
Thanks, Rachel. So 45-day requirements, we are currently in the process of planning a recorded webinar training on the first 45-day requirements. We're in the planning process. We're going to put that together. We look at sharing that in early September. Since the first day of the school year, as Rachel mentioned, is August 30th, we're encouraging everyone to look in the cells and prepare your staff to complete the mandated 45-day requirements. Just as some reminders, all children birth to 5 must complete an up-to-date physical prior to attendance. We need to obtain dental exams within 45 days. We need to determine whether families have a medical home or dental home within 30 days of enrollment for Head Start and Early Head Start. For our PFA and PI programs, we need to follow the Illinois licensing standards for PFA and PI. We need to obtain physicals for home visiting children within 90 days of enrollment. And of course, we need to conduct our developmental screenings within the first 45 days of enrollment. Also, just a reminder, according to the CELS 2.0, as of July 1, we can start, or we could have started screening our returning children. So just a reminder to start with the returning children. You can do that now. And for screening materials, I just wanted to say thank you all for responding to our survey regarding the developmental screening material needs. If you have materials on site, by all means, begin to use them. We have reviewed these requests and are in the process of purchasing early development screening tools. As we receive information on dates and delivery, we will respond to the email address that you used to submit the survey. In other words, more information coming. In addition, Angela Hughes, if Angela, I'd like to pass it to her so she can discuss some hearing and vision 45-day requirements.
Good morning, everyone. Just as a reminder, as everyone has already said, the first 45 days will consist of our Head Start component of children, and the technicians are already geared up to reach out to the agencies to start scheduling the hearing and vision screenings for those 45 days. We will be targeting the Head Start first, but we also will be including the PFA children. We will be doing the PFA children after we complete the rotation of the Head Start children, because the Head Start children have the 45-day mandate on them and PFA does not. PFA children are usually screened annually. So the technicians will be reaching out to the prospective agencies and sites to set those dates and time. So look forward to those calls and those reach outs from the team. That's my update.
Thank you. Thank you, Saraythel. Thank you, Angela.
And Karen, I think Seth is all done. Can you go to the next slide?
Sorry. Next slide, please.
Good morning, everyone. Thank you for joining us. So we have some program admin updates. The first one is staff changes. I just wanted to make sure that everybody knows that Victor Santiago, the Assistant Director of Fiscal Contracts and Data, he is no longer with the department. And so if you have reached out to Victor and you are waiting on a response, you might as well go ahead and email me. So yeah, make sure that you follow up with Tiffany Junkins if you have something that is pending for Victor. I will try my best to go ahead and respond to those emails in the order received. I just ask for your patience in the process. We also have a couple of new staff, and I just wanted to go ahead and mention them as in doubt, you know, working with our programs, you will definitely be able to develop a relationship in these two areas as well. We have a new deputy commissioner of finance. Her name is Nicole Latimer Williams, and Christine Rowland's old position is what she replaced. So if you guys are familiar with the work that Christine Rowland did, then Nicole Latimer Williams is in that place. There is still no replacement for Glenn Lazan at this moment, but Nicole Roberts has been filling in. She's the supervisor of accounting and finance, and she's been filling in as much as she can. So please have patience in that process as well. But understand that Nicole Latimer Williams, she is the new deputy of finance, and she is working closely with Nicole Roberts. So if you have any questions, feel free to reach out to our finance division as it relates to finance related matters. We also have a new director of grants. His name is Raymond Barrett. And we have not filled Madeline Shea's old position, which was the chief planning analyst position, but Raymond Barrett, the director of grants, is a replacement for Jackie Tima. So Jackie Tima was formerly the director of grants, and now it's Raymond. And so Raymond will be working very closely with us in terms of our grant applications for our funds that we receive. So we're super excited to welcome the new team members aboard, and feel free to go ahead and welcome them. Reach out if you need to. So finance and grants, we have new staff, so we're super excited about that. Wanted to also mention that the CSD updates that we send out, our communications team are now increasing the CSD update in an effort to make sure that you receive it. We have put a lot and packed a lot of important information in CSD updates in the past. And sometimes you have to scroll down quite a bit in order to get to a lot of more useful and valuable information. And so in an effort to go ahead and streamline our communication and ensure that we're not exceeding our volume when sending them out, we are now breaking them down into two parts. So we will be sending a CSD update on Mondays. The Monday CSD update will contain resources, hopefully, that you can use. And the CSD update on Wednesdays, those are going to be more or less for deadlines, reminders, things that you need to know, those types of things. So just look forward to receiving our CSD updates. At any point, if you don't get a CSD update within a week, please reach out to me. Please reach out to my team. Karen Perkins is our supervisor of communications, and she works very closely with Mara Martinez. And we want to make sure that the communication that we are intending to provide is being provided. So at any point, if you're not receiving that communication, please let us know. Be more than happy to make sure that we check the system so that we can get you the information on a regular basis. Wanted to talk a little bit about rollover. We did roll over and we rolled over early. As most of you know, in the past, we have rolled over when we're ready to start our new program year. And that usually aligns to Chicago Public Schools. This year we had to roll over early, and we worked with our funders in order to do so because this aligned with our grant ending. Our grant originally was set to end June 30th, and then we got the 30-day extension, so it ended at the end of July. As such, then our new program year, when we did the rollover, it was to go ahead and start a fresh year on August 1st. I just want everybody to understand that the rollover happened, so all the data goes through the end of July. So August 1 for us is kind of our fresh new start in our system. I know I had somebody reach out and says, Tiffany, what is the beginning of the program year? The beginning of the program still aligns with Chicago Public Schools. But this year is going to be an anomaly, right? Because we had to roll over early in order to go ahead and get through this competitive process and make sure that the new grantees were set up for that August 1st start date. So the month of August, even though August 30th starts the beginning of the program year, August 1st through the August 29th will be tacked on to this PIR. I want to make sure that you are aware of that. So this is included in the PIR data for the new program year. And the new program year for us, it does start August 30th to align with Chicago Public Schools. Hope that's not too confusing, but definitely reach out to us if you have any questions about rollover, if you have any questions about the PIR, and we'd be more than happy to go ahead and accommodate any of those inquiries. Wanted to also mention that Chicago Public Schools, we got notification yesterday that they are mandating staff vaccinations. And so I thought that was important to go ahead and share with this group. So CPS staff must provide proof of vaccination by October the 15th. The exceptions are religious or medical exemptions, but everyone else must provide proof of vaccination by October the 15th. Unvaccinated staff will be required to test on a weekly basis. And those who do not fall into compliance, there will be other measures that CPS will be taking in those instances and leading up to termination. So I just wanted to make sure that you guys were aware of the stance that Chicago Public Schools is taking as you guys start to think about, you know, your own organizations and kind of monitoring your staff and seeing, the percentage of vaccinated. We want to go ahead and, keep all of our children and families safe. We want to keep our staff safe as well. And those policies you guys develop within your own organization. And so, sometimes when we have our LEA, our local education agency, making a stand such as this, sometimes our agencies decide to go ahead and take a similar stance. And so I just want to make sure that you guys are aware that they are mandating vaccinations, and that you guys kind of take a look at your organization to try and see how you're going to go ahead and move forward in this respect. Next slide. Okay. We have a lot of contractual transactions that are happening. And so I wanted to put them all on one slide so that you can see them. There is a lot going on as far as contracts. And so we have contracts out there. We wind up sending awards out for COLA, and COLA during the first period. The December through June COLA amounts, those are already out there. Most of you have already completed that process. We do still have some that we're working our way through to go ahead and try and finalize that. July itself was not included in that award, but I want everybody to understand that July should have been paid at the increased COLA costs. And so we didn't forget about July. July is something that within your own organization, once you accounted for the December to June retro payments, then July is something that should have been paid at the increased 1.22% of staff permanent increase. We also sent out contracts for FY21 for Head Start and Early Head Start. They were 1-month contracts. Those were the contracts just for the month of July because our funder had asked us to go ahead and extend. They weren't prepared to go ahead and start those awards based on the DRS and the bringing on of the 5 other grantees. And so we were asked to go ahead and do the 1-month contracts for the month of July for Head Start and Early Head Start, which we did. All directly operated delegates wind up getting the award to cover the month of July if they showed within our financial system that it was needed. And we work with other organizations, other directly operated organizations, one by one, to go ahead and kind of reach a conclusion one way or the other. We also increased some of the support service contracts, and that was based on a needs basis for the month of July. But if there was salvage dollars in either the delegate awards or the support service awards, then we did not provide additional money. What we did is we did budget modifications to go ahead and extend the budget terms so that any salvage dollars could be used through the month of July. So regardless if there was more money or if there was just a time extension on those budgets, those still resulted in contractual transactions that still had to occur. So those are out there. Hopefully we are at a point where we are starting to complete those July transactions, but I do know that some are still out there and we're going to work our way through those. FY21 as well, Head Start, Early Head Start, 2-month contracts. Our funder has given us some additional dollars to be able to support the unfunded and also the underfunded. And so this is 2 months for the months of August and also September to help support transition activities. This is not to enroll any new children into programs. This is to help support transition activities, whether the child is going to be remaining at your site or they're going to be transitioning to another program, another Head Start program, non-Head Start program. The funding that's being provided here to the unfunded and underfunded is to support transition activities only. And so that's for 2 months. Those are, again, contract transactions that we've sent out to be able to cover the cost of those transition services. We've also sent out letters recently asking for you to go ahead and help us be able to get information on every single child so that we understand where those children will be. If they're going to remain in your site, if they're going to be transitioning to another site, if they're going to be going to kindergarten, just, complete the paperwork, make sure that you send it in. We provided an email address on the actual letter, but we will need one for every child in the Head Start, Early Head Start program. The other contractual transaction, well, we have a lot of them, but FY21 Head Start, Early Head Start, there will be 3-month contracts. My deputy commissioner, she wound up sending an email out to be able to make sure that people were aware who were unfunded and also underfunded, to know that some additional support was coming, financial support. And so that financial support is for the months of October, November, and December. So this will be a 3-month contract that is coming. We are in the process of trying to get those awards out the door. Those have not been sent yet, but my deputy did send an email out to those agencies that will be affected. So hold tight, know that additional funding is coming to be able to support your programs as you are transitioning families and you're trying to close out your programs. We understand that additional resources were needed, and this is what those dollars will be for. FY21, we've also sent out Head Start, Early Head Start, CCP, and expansion 4-month contracts to delegates. And so August through November, those awards are out there. For our support service contracts, we have not sent out Head Start or Early Head Start. We've only sent out CCP and expansion as we're still trying to work through what those allocations will look like and trying to make sure that we can appropriately support the programs at a reduced cost. So for our support service providers who are waiting on awards for Head Start and Early Head Start, just understand that we're not there yet. We are working our way to a resolution, and we are hoping to have that out to you by the end of the month. This will not be a retro situation where we're going to be able to go back. So I don't intend on us being able to cover expenses for the month of August in this situation. We're going to be looking to move forward in those conversations and with those awards. But if you have any questions, definitely let us know. You know, all of our support service contractors, you do have program managers that you can feel free to follow up with them, or you can follow up with myself. Another contractual transaction that we have out there is our FY22 Early Childhood Block Grant, PFA and PI, July 1st through June the 30th, 2022. That's an error there. So delegate contracts are out. We are processing PI contracts first, and those are 12-month contracts, and PFA contracts, we're going to be working through those secondary since those don't start until September. Although September is quickly approaching, we want to make sure that we get all of this done. But I just wanted you guys to understand that there is a lot of contracts being processed at this time to support our programs. Thank you. Let's go to the next slide. So grant applications, we do have 3 grant applications that are going to be due soon. My deputy commissioner, typically for people who've been, you know, a part of this for a while, you understand that grant applications are usually due September 1st. We have been given a approval to go ahead and submit 30 days later, which is October 1st. So Head Start, Early Head Start is under one grant award that is due October 1st. Also, our Early Head Start Child Care Partnership is due October 1st, and Early Head Start Expansion is also due October 1st. Information will be coming soon. We need to get you instructions out soon, and also a grant application training should be coming soon as well. We are working with our new staff in our grants unit, so your patience is asked for, but at the same time, we will be needing to make sure that we're going to be able to meet this deadline. So look forward to information coming really soon regarding our grant applications. The slot reallocation. I just wanted to make sure that I mentioned so that everybody understands the position that we're in when it comes to Head Start and Early Head Start. For the 14 organizations that did receive funding under our new grant award, we are asking you to hold steady with those slots. And I know that that may be hard to do. We received a lot of proposals for people wanting to go ahead and make changes, et cetera. There's going to be very few exceptions that we'll be able to make in the space. If there are any licensing concerns, for instance, license capacity is being breached, where, you know, we've awarded you slots where you just can't because of license capacities, please let me know those situations.
Yeah. I see.
Can you put yourself on mute, please? Thank you. But there will be very few exceptions made. You know, I want to be able to kind of hear where you're coming from. Our funders have agreed for us to be at the locations and in the community areas in which we are. We have come from a place with our old grant under the 145 million, from being in over 60 community areas to now being in 38, 39 community areas. And so our footprint is a little smaller, although the city of Chicago does have the biggest grant in comparison to the other 5 grantees. Our footprint still is smaller, and we have to make sure that we're respecting you know, the community areas in which other grantees are present in, and we just want to be responsible with these dollars and any movement to them. And so not trying to be insensitive to your needs. If there are needs in this space, please go ahead and let us know, but there will be very few exceptions made to movement for Head Start and Early Head Start. With that being said, we still have a CCP grant. And so if you're looking for movement there, I just ask that you go ahead and kind of let me know. And also I'm going to be working closely with our program ops supervisors to make sure that the movement that you're asking for, to ensure that we're in compliance as far as teacher qualifications, facility inspections, licensing, and criminal background checks and things like that. And so, you know, just make sure that you're communicating with us what those needs are, and we will be getting back to you regarding those requests. The contract
Tiffany,
division.
I'm
Yeah,
sorry.
sure.
When you're done, Tiffany, I want to chime in on something, but go ahead.
Sure. Our contracts division, they wanted to make you aware that effective July the 19th, all of the contracts no longer require a notary public. So that's no longer required with the contract. Just wanted to let you know. So for all of those who had to frantically go out and find a notary to go ahead and notarize your contract page, that is no longer required to process your contracts. Any contracts, though, that have a date of, let's say, July the 18th, if it's going to be signed July the 18th, it still requires a notary. So if the date is July 19th on forward, there's no notary required. So I just wanted to make sure that you all were aware of that. So Rachel.
Yes, thanks, Tiffany. I just want to chime in on two things. Number one, as Tiffany was talking about the Head Start, Early Head Start, now that it is a smaller grant in comparison to where we were, and we have a much smaller footprint, meaning the number of communities, we will be meeting with those 14 delegates that are under our grant to talk more about, you know, community recruitment and all of those things, because this is new. This is new for us. We've had City of Chicago as our landscape up until now. We do share many of our community areas with other grantees, and we just need to make sure that we're all on the same page about how we'll be doing this. I know we'll be talking with grantees as we move forward, but also we'll want to have conversations directly with those 14 of you to make sure that we answer your questions, and more specifically, to talk about how we will be doing this going forward as far as the City of Chicago, as we're looking at enrollment and recruitment. There was a question also in the chat box that if we lost our Head Start slots, but we're funded through December 31st, do we freeze enrollment? And the answer to that question is yes. What we don't want is additional families impacted by these changes. You're funded through December 1, and you can continue to serve the children that are enrolled, but we ask not to enroll new children and have them impacted, meaning that they would then have to be moved from your site at the end of December. And we don't want any more families to go through the changes that we're going through right now with transitions. We hate those that are currently impacted, and we just don't want to add any more to the mix. If you have any additional questions about that, Gabrielle, please feel comfortable, chime in, reach out to me. But we're asking everyone who's impacted, we've extended your funded or underfunded. And Tiffany mentioned that earlier. We were able to extend some funding through September. Office of Head Start, the regional office, did give some additional dollars to do it for August and September. The mayor's office has developed funding for October through December. And so again, what we don't want though is more families impacted by this. So we are asking you to freeze your enrollment. The other question is, what should we do with Early Head Start who would have moved to Head Start this school year? If you're moving them right now because they're in your program, they're currently enrolled, if they're eligible, and you're holding on to them for the next few months, then you can do that. The team will be working with you, and we've sent out emails asking everyone to go to families and ask families, what are their choices? Are you wanting to remain at the site where your child is currently enrolled? In this particular case, what I would say to that parent who's transitioning from Early Head Start and eligible for Head Start, that parent needs to understand they can make a choice to stay there right now, but they need to also understand that you won't have Head Start starting January 1. And if they choose to stay with you, which they can definitely do, and if you're able to maintain those children in slots there, then those children can stay with you beyond that. Again, with a different funding source. But these are conversations that we're asking everyone to have with their parents right now. So parent choice is a part of this, and they get to decide if they want to remain. And if they decide they want to find another program, my staff are available to work with parents to help them find a seat in another Head Start or Early Head Start program. And so we're continuing to work on this, and we'll be working on it for months. Well, the PFA contract start dates changed to the new program start date. The PFA contract dates are set. They are dollars that come directly from the state. PFA contracts start July 1 and end June 30th. There's no change to that. Tiffany, back to you.
Thank you. Next slide. And so our enrollment update, you guys, this is for the month of July. And so for Head Start, we're at about 51%, PFA 63%, PI center base 70%, PI home base is 83%. I think we've always performed a lot. We've always performed well when it comes to those PI home base slots. So thank you for our home base programs rocking it out. Early Head Start, we're at 79%. CCP 66% and expansion 78%. You guys can see the numbers, and so I'm not going to go ahead and kind of go into those. One of the things I do want to mention, and my deputy has already mentioned this, is we're going to be needing a lot from our delegate agencies moving forward when it comes to enrollment. Right now, we're in a period of transition, and I get it, and these numbers, they definitely reflect that. But as we are starting to move forward, we are going to be needing to partner with you to make sure that we can reach those full enrollment mandates. And this is going to be one of those cases where, as we kind of look forward, we're not going to be seeing percentages like this. And we're going to need your help in order to do that, right? So this is pretty low. I can tell you now, I have a lot of organizations who have reached out to me asking me for more slots. And what I have told every organization who has reached out to me asking for additional slots is, I don't have them, right? They're all out within organizations. DFSS isn't holding a slot back. I have none within my possession that I can give anybody, okay? So for those who need more slots, they're gonna be, the only way they can get more slots is if you're underperforming, okay? If you're underperforming, I will have to have a conversation with our organizations that are underperforming, because we'll have to think about how we allocate those slots to where they can be used by children and families who need the services. Those are going to be difficult conversations to have, because we haven't touched slots and we've kept them within organizations, and we've kept organizations fully funded, especially through the pandemic. We want to be able to make concessions where we can and where our funders are giving us concessions. But we do have a full enrollment mandate with the new program year. So I'm going to need all of you all to work with me. I'm going to work with you, but we do have to improve these numbers. And so what we're seeing here is absolutely a period of transition, and we recognize that. But we do have to do better. And we're going to be working with you in order to make sure that we can meet that mandate. And that being said, I am going to ask for Karen. Karen, could you do me a favor? Because I've had some people ask me in the chat, how can they get these slides? Can you go ahead and let them know how they can go ahead and get the slide deck?
Hi, everybody. We can send this out in the CSD update. If we need to send out a direct email, we can also do that as well. So I can go ahead and put my email address in the chat. If you want to directly communicate with me about getting this particular deck, we can go ahead and do that.
Yeah. Thank you, Karen. And I mean, just because I wouldn't want to bombard you with those requests, I think that it would be fair to say that we can put it in the next CSD update. Next slide. I'm going to turn it over to my deputy. Well, Sharon, a mission of change. I thought you had something there, Saratho.
No,
I'm sorry.
no, that's okay. I am right here. I am here.
Okay.
One of the things I just want to remind everybody, there's a lot of change that's going on right now in the landscape of early learning in the city of Chicago. And also some things statewide that we'll be acknowledging and talking about very soon as well. But one of the things I just wanted to make sure, and I know you're just looking at enrollment. Can you go back to the enrollment slide, Karen? And so the next time you get this, you will be getting it as effective for our new numbers in Head Start, Early Head Start. And we'll be, each time we meet, we'll be talking about where we are with enrollment. If you're looking at this was effective at the end of July. And again, these are acknowledging numbers for that just as we were rolling over. And so if you're looking at where we were when we were doing roll over, we were really low. Our Head Start numbers, we were at 51%. And if you look across, we were low across all of our funding streams. And we understand we've been in COVID, still in COVID. It has impacted your enrollment, and we understand what's going on in community. But as we move forward into this new program year that starts at the end of August, one of the things we, again, are looking for is full enrollment as far as our mandate from our funders. And we really need to do everything we can to get a child in every one of those seats. And for example, for our Head Start, we have 1,489 slots. And so I can say as of yesterday, we weren't even at 1,000. We were still hovering around 300 and some children enrolled. And so that's why I'm impressing upon everybody. And I know you got children. I know you are getting some other enrollments, but we need to see them in COPA in order for us to be able to see where you are with enrollment. And so my ask of you is to work with your staff that are doing enrollments on your side and make sure that they're getting those kids in the system so that they are reflected and we can see them. One of the things that we're going through, and I'm just going to say this for PFA-PI, and looking at where we landed with our PFA-PI and working directly with CPS on our numbers. And so they as a funder by right want to know what are we doing about making sure that we're enrolling and doing everything that we can with and for the funding that they're giving us. And so this year is going to be a lot of communication coming to all of you regarding enrollment, making sure that we're getting kids in seats, that we are getting that data in system so that they're reportable. And also the fiscal side of this, we'll be working with the fiscal team to stay on top of what we're doing and how we're vouchering. One of the things I want to say right now, as we've just gotten to the end of our PFA-PI contract for June 30th, and just know with that, one of the things that we don't want to do is we don't want to continue to leave dollars on the table. And that means that agencies have to have a consistent methodology for how they voucher the city of Chicago. And waiting until the last minute to voucher does not allow you the opportunity to do a budget revision, nor does it allow us, DFSS, to do a budget revision, which we would have some ability to do along with CPS. And so we're definitely going to do some things different this year in managing these contracts. We're going to be working closer with you on both your enrollment and also your vouchering and making sure that the dollars allocated are being used. And if they're not, then we'll be talking about what we need to do as far as budget revisions. And if there's an opportunity to move any dollars, then the team will work with you. But again, we can't go into this next program year experiencing the enrollment issues of last year. COVID, again, we know we're not out of COVID, and I'm acknowledging that. But we've got to do better of getting children in seats. And we've also got to do better of expending our dollars that you are awarded in these contracts and in these grants, because just like you were under enrolled, we were also under expended. And those are issues that we definitely have to have a resolve for. And so there'll be more work coming around all of that. I see, and I'm going to go back to the chat. I see a comment about physical appointments for children are taking longer than usual. And we're hearing that. We understand, and what we're asking everybody to do is if there's any, clinics in your community that you can talk to kind of be a help agent for your parents so that they have somewhere they can go to get these physicals done. Again, that, whatever you can do on your side, because it is an issue. And you do need the child physical done. And we do understand that appointments are taking longer. We understand that these are issues. And so just keep communicating with your teams here, letting them know what you're running up against so that we'll understand better of what's happening with getting children enrolled. And so thank you for putting that in the chat box. I'm sure just like you put that in, there's probably someone else who could probably put the same comment in there, because we do know that our pediatric physicians are really running behind as far as getting all of the physicals done for all of the children that need them this year in order to get them enrolled in your program. But again, acknowledge that up to your team supervisor, your team leads, so that we're aware of what's going on, so that we can notate that and have an understanding along with you on what it is that's going on, and then what you're doing to get by it. And then if there's anything that we can do or support, or any ideas we have, we'll share those with you as well. And so I've gone through the chat box trying to see, and I know I've been responding to questions, and so has my team. I think we've responded to all the questions, but if there are any additional questions, we've got a little bit more time in the agenda, and we welcome you to go ahead and give us your questions right now as we move to questions and answers.
I was wondering, how are you doing the school year on August 30th? And what are you doing between August 1st to the 29th? What is that considered?
That's it, your enrollment. We're asking you to do everything you can to get children enrolled in your programs right now. That's what we're gearing up for, is to make sure that we're using that time to get kids in seats, get our enrollment done. Right now, our contract started with Office of Head Start, for example, with Head Start, Early Head Start, August 1. And so we have got to make sure that we're getting every child and every family acknowledged and in program, is what we're asking everyone to do. So, this is, frenzy week, trying to get everything we can get done. Program year starts on the 30th, and we'll see exactly what our enrollment looks like on that Monday. But we'll be following up with everybody. We'll be looking at wait lists. We'll be, asking you, what are your teams doing? What else are we doing? Because again, when we're looking at slots, and, Tiffany kind of mentioned it earlier, we've got to be enrolled, and we don't have an interest in going to anybody and talking about, what we might have to do about slots. We want to make sure that you're able to allocate and use those slots. But the only way that we'll know that is children are actually enrolled in your programs. And so right now, what we're doing is doing everything we can to get kids enrolled. And that's what we're asking all of you to do. We've had people out and about. I know we were out at Billiken last Saturday, making sure that, everybody understood, enrollment is happening now in child care centers. You guys are ready to enroll. Please go and enroll your children in early learning right now. And so we've got our, canvassers out in community. We've got, all kinds of things going on. We've had people out at all the festivals, letting parents know that early learning doors are open, please enroll. And we're asking everybody to do everything and be a message carrier about early learning and make sure we can get these parents in. But right now, I'm looking at enrollment. I'm looking to see that we're getting children in seats and children in programs.
What are you doing for remote learners or those who are
There
not?
There is no remote learning. And let me say this, Head Start is not allowing us to do remote learning. CPS, ECBG is not allowing us to do remote learning. What we've said is we are fully open for face-to-face environments across both of our funding streams. And so we're expecting all of our children to be in classrooms with teachers face-to-face this program year. I see a question in the chat box asking about doing some PI home-based specific meetings. Yes, we can look at doing some of that. We'll get back to you. I'll talk to the team and see what we're able to do as we think about some of specific things having to do with different funding streams so that you can get your questions answered and then we can bring information directly to you. So we will definitely work with PI home visiting. My site that no longer has early Head Start and Head Start, are we able to access the 3455 in COPA when assigning a PFA, CCAP model and PI CCAP, please advise. Thanks for that question, Dorothy. I'm gonna have to go to my staff because I do know that you are in there for your PFA, CCAP. You are in our system for those. But if you're unable to do the 3455 because of your classrooms are not set up in COPA, and that's the restraint that we have because you're no longer in there for those, you're unable to access the 3455 online when you're assigning it. And so let me go back to my team and we'll be talking about that piece of it. And so as far as enrollment, what we're asking is everyone is that when you're enrolling children for your current children should already be in there. They should have rolled over. If those children were in your system as of the end of July, those children should have rolled over into your seats that you had assigned them for based on their age. when you're looking at new children, it should be vacant seats that you did not have a family or a child already in. And so we're asking you to make sure that you're any new slots that you have, that you're enrolling those, but that you make sure, for example, that all of your children that should have rolled over, that they're in your complement of classrooms. And so have your staff check that, make sure all your children are present in the right area. If they're early Head Start, that they're in early Head Start. If they're Head Start, they're Head Start. If they're PFA, they're PFA or PI, making sure that they're in the right place. But making sure that they're in the system is the most important thing that you can do right now. And then enrolling your vacant seats and getting to full enrollment is what we're asking everybody to do. I've got a couple of messages I'm going to reply to. They're asking for team members that they can get some additional information from. I'll reply back to you in just a second. And so, Sarah, thank you for your comment. I'm just going to say, this has been a heavy lift for my team, and I have to thank them every day. And I do everything I can to keep a smile on my face and keep them up, because again, this has been a lot of work, and it's been a heavy lift, and we are not at the home stretch just yet as far as DFSS and its work that they'll be doing. And so we know that this is a lot for you all as well on the other side of this, and we're doing everything that we can to support you as best we can, and trying to keep the needle moving in the right direction on all of this work, and in support of you every day. That's what we're here for, is to be here with and for you, so that you can be successful in operating these quality programs, and being there with and for the children and families that you work with every day. And I can't thank you enough for everything that you do. And I know when everything changes here, it changes your life over there. We just want to get to a point where we can just be level set for a little bit, just so we can enjoy doing the work that you do and enjoy those families that you serve every day. And so,
look, thank you, Sarah and Linda. No, we appreciate you guys as well.
Absolutely.
We definitely appreciate you guys allowing us to work with you and partner with you. We know that this has been a wild roller coaster ride with ups and downs. When the city has had a monopoly on the Head Start program for decades, over 56 years, change is inevitably hard for everybody involved. And I just want you all to know that any decisions that had to be made, they were not a reflection of you as an organization. We believe that the programs that came out of that 2019 RFP were the right organizations. We really do believe that. But change is inevitable, and it has occurred. And when it hits hard. I don't want you to think for a second that we don't value our partnerships that we've had and will continue to have, because we do. For a lot of the organizations under Head Start and Early Head Start, specifically, you guys are on other contract awards with us. And so we're going to continue those partnerships in those areas. We're grateful to have partners like you to be able to kind of move this work forward with. But thank you so much.
A couple of things. And Krista, I see you're here. I see a comment from you. Would you like to unmute and talk to people about the changes going on with you and your organization?
Sure. Hi, everyone. So Krista Hamilton, CEO, Executive Director of Centers for New Horizons. So I will be transitioning from Centers on September the 3rd after 10 years of service. I am passing over the baton to Dr. Joanne Howard. She has my name. Can you wave, Joanne? She will be our interim CEO until a search is conducted by our board of directors. So for about the next 6 months or so, Joanne will be acting in that role. And then Lakeisha McFadden, who you all know is our program director for early care education. She has been promoted to our director of operations. So she'll still be very close to the work, more on the fiscal and the facilities end of things, but she'll still be there supporting our child care director in our programs.
Thanks, Krista.
So thank you, Rachel. Thank you, Tiffany, and all the partners on this call for just being such an amazing partner to me. Unfortunately, we won't have early care education where I'm going. I am going to UCAN, so I'll be out of the touch with you all for a while, but still very closely connected to centers and this work. So thank you, everyone.
Thanks, Krista. And also, Tanika, I see that you put something in the chat box, and again, we're very sad to say that HANA Center is actually effective at the end of this month, closing their doors to serving children in early learning. Tanika, would you like to unmic and say something to the group?
Sure, yes, I can say something. And sorry if there's a little noise. I'm actually also double tasking, getting some appreciation gifts for all of our staff right now. So unfortunately, due to the loss of funding for us, Head Start made up 35% of our early childhood funding. We operate a small center. We will be closing. And so I just want to take the opportunity on behalf of HANA Center and our Early Childhood Center to say thank you to everyone for your partnership and all of the amazing support that we have had together over the past 4 decades. And also congratulations again to Krista. But yeah, it's a sad moment for us. We're fortunate that all of our families have new placements. For us, this was a really hard decision, but we wanted to time it with the end of the school year so that families and staff have the most options. And so all of our staff who wish to continue in early childhood have also secured positions, except for one that we're still working to finalize. And so thank you to the partner organizations that have been working with us for our families, our children, and our staff. And thank you again to DFSS. And I just wanted to say that so it doesn't seem like we've just disappeared.
Thanks, Tanika. And again, we're very saddened and that, you know, that this was the outcome from this application. It definitely wasn't something that was intended, and we are very, very saddened over the loss. And best of luck to all of you. And you guys the way that you're doing it with your children and families is just commendable, everything that you're doing, and we really thank you. I don't see any other questions coming into the chat box. If there's anything else that anyone wants to add, we've got a couple more minutes and we welcome it. I don't want to just hold you on. I know everybody has a lot to do. We're all busy, so I'll give it just another minute or so. And if hearing none, then we're going to give you some time back in your day.
Sarita, I just wanted to add one thing at the end of the meeting, and I really wasn't going to say this, but I think that it's appropriate. You know, I mentioned change is inevitable, even internally here. I think those who know from prior meetings that Madeline retired in June. We had lost Beth earlier. She had decided to leave the city of Chicago and to go off onto her farm. And then losing Victor recently. So there's been a lot of change. I do want you guys to know that I'm going to be working very closely with our supervisors in the program admin unit. Just to know there's a lot of support here. And, you know, Craig will continue to do data and enrollment for us. And so he is the supervisor of data. Zariah, she is the supervisor of fiscal and contracts in the program division. She works very closely with our finance division to go ahead and get those budgets and scopes and contractual documents approved. So she will still be the point of contact, and I'll be working closely with her. Tasha Smith. Tasha is the supervisor of our planning team. And so when it comes to communications, self-assessment, when it comes to community needs assessment and communication, and she also works very closely with our Citywide Parent Policy Council. Tasha will still be taking the lead in that area. And then I also have Karen Perkins. She's the supervisor of our communications team. So internal and external communications. Karen is the person who is responsible for that work. In addition, Karen also works very closely with our vendor on marketing and outreach. And so when it comes to marketing and messaging and getting the word out there about the wonderful work that we're doing in Chicago Early Learning Programs, Karen is that person who represents us. So I just want you guys to know that there are other people in this fold. I don't want people to feel like just because we have some folks who are gone, that there's not people who are doing an outstanding job and who can do the work. And they also have teams that they also work with as well. So change is happening. But I'm really excited to be able to work closer with our supervisors as we continue to work on behalf of children and families in the city of Chicago.
Tiffany. And so one last piece of information, seeing no other questions, I'm going to end with this, just so everyone knows, and I'm sure you've gotten the information, and if you haven't, Governor Pritzker has formed a new division of early childhood at the state level. We do know that the new director of that program is coming directly from one of our delegates at Erie House, and that's Kirsten, and I blow her name every time, so I'm going to say Kirsten, who is now been appointed as the director of that new entity at the state level. And so there'll be a lot more work being done in the city of Chicago, state of Illinois, around early learning, and more information that we'll be sharing with you in our next meeting about the way everything is organized in 6 distinct areas in the state of Illinois, with a council in each of those, and in the city of Chicago, because of its size and complexity, will have its own council. So there'll be more information that we'll be sharing with you about how that new system of early learning from the state level will play out here across the state. So we'll be giving you more information and keeping you up to date on changes in early learning, and keeping you abreast. One of the things that, as always, we all need to advocate for early learning. We hope that you've heard is that our President Biden has said he's got some emphasis on early learning, wanting to make sure that we're finding a pathway to paying for early learning fully, that is paid, that parents have access to early learning across every state at a level where the parent can both afford and find access. And so there's more work to be done with some of what he wants to do, but there's many dollars coming into states right now around early learning. And so the state of Illinois is using those dollars to make some decisions about how early learning and everything will be done here in the state of Illinois. So more work, more information to be shared, and more information that you'll be getting as we move forward. Gabrielle says she has some specific questions, and I see you. I will say right now, Gabrielle, if you have specific questions about your center, if you want to reach out to me, you can do that, or you can reach out to your team lead. And if they are not able to answer your questions, then they will be able to direct you to who in the division is the best person to do that. And so again, we're here. We are going to be here with you, riding through this. Change, as Tiffany said, is inevitable. Not only is change gonna happen. I'm just all over myself this morning. It's inevitable, but not only is change that, change is also an opportunity. And so I'm hoping that everyone here sees this as an opportunity as we move forward. We have a new landscape in Chicago for early learning. We have a new way of how we will be doing our work. We are going to be teaming and working together as we move forward. And we believe that what we do in Chicago is provide quality early learning to children and families, from pregnant moms all the way through. And we're going to continue to do that. This is going to be a partnership, a collaboration, and we're going to make this work in Chicago because that's what we do here in Chicago. That's what's going to happen. We're going to be here together through this. We're going to see each other through this. There will be a point in which I'm hoping that we'll all do one thing, which is, be in the face of each other and be able to see each other physically present very soon. And that's my hope for all of us, that we get beyond this pandemic and that we can be in front of each other so that we can do some of our networking. We can just be physically present because as much as we are doing all of these great things virtually, there's nothing to be said about being personal and upfront and right there with all of you. Believe me, DFSS, we miss seeing all of you. I'm glad that we moved over to this medium so that we can at least see faces that are turning on their cameras. But I'm looking forward to the time when we no longer have to do it this way and we can be back in a room together. And so looking forward and looking for opportunities and making sure that we're serving every child as best we can in the city of Chicago. And so my hope is for a positive future. What I'm asking each and every one of you to do is stay safe, be good to yourself, take care of yourself. As some people are saying to me in this chat box, and I thank you for that. Doing everything I can to take care of myself. And I'm just going to say, I take care of myself. And then I left this is an aside to everything, but, left the Bud Billiken parade on Saturday on my way home to get myself some respite, and had a car accident. And I'm fine, everyone. But my car, not so much. They contacted me yesterday and said it's a total loss. So, you know, change is inevitable, people. Even when you're not planning for it, it hits you right there. And so we've got some work to do on my side of the house, just trying to make sure I've got wheels so that when we can be physically present in the same place, I have transportation and can get there. So again, I just look forward to seeing all of you, and I look forward to all the great work that you're doing. And I thank you as always for everything that you do for every child and family and all of your staff and yourself, what you do every day. And so please, please, please take care of yourselves, stay safe, do everything that you can to take care of yourselves and everyone around you. And we'll talk to you soon. Thanks, everyone.